Good evening and welcome to the Maternal Health channel. Thanks for all your comments on our Facebook page and contributions to our radio discussions. We would like to hear from everybody wherever you are in the country. Please go to our website at mhcghana.com for all the information you need to get involved in this national campaign to save lives. Tonight, we continue to review progress on issues raised in the series and to feed directly into the national policy dialogue. The idea is to take stock of developments and invite key policymakers to discuss the solutions. Tonight, we focus on remote communities and their access to essential maternal health services. As we saw from our programs on Bompa and Kutebwem, this can be very challenging, leading inevitably to lives being lost. Our program on traditional midwives also suggested that the issue of skilled health personnel remains critical in most remote communities. What is to be done? What are the essential elements of a practical strategy that can ensure that remote communities are best served in order to save lives? Before we get into the discussion, please take a look. We are back on the bumpy dirt road to Kutebwem. Thankfully, it got easier as we progressed. On the outskirts of town, we chanced upon a unique structure of a classroom. It had some truly symbolic writings in Ewe on the blackboard. Count your blessings one by one. Obviously, the health system is not the only one in need of support in this community. In Kutebwem, we drove straight to the health post. So we've finally arrived at the health center here in Kutebwem, but it doesn't look like it's open. I would imagine on a day like today, if it was open, there would be people waiting in the courtyard for some assistance. Even a mobile signal doesn't work in this area, even if you wanted to call for help outside the community. We sent word round for the nurse.
Hi.
Hi, I'm Ivy.
I'm Grace.
Grace, nice to meet you.
Welcome.
Thank you. Grace explains that the clinic opens at 8 in the morning and closes at 3 in the afternoon. So what happens if somebody is sick after 3?
They will come and call me in the house.
Okay, they come to your home,
yes.
and then you bring them here to treat them.
Yes.
Are you a doctor or a nurse?
I'm a nurse.
You're a nurse. There's many nurses and doctors and health practitioners who don't want to come to remote areas like this. Why did you choose to come here?
When I was trained, I pledged that anywhere, no matter what they post me, to go and take care of people, I will go. I have to go. Health is more important than anything. So when they posted me here, I don't have any choice. It's not even good when I say I cannot come here because there's no network, there's no this, there's no that. So the people there who should take care of them.
Grace took me into her clinic. What exactly do you do in this room?
We detained people here. If somebody come and we know that the person is very weak, rehydration, and we have to put a drip on the person, we detain the person for some time. This is the detention room. If somebody is in labor and somebody too is detained here, where will the midwife deliver the person?
She has an even smaller room where she keeps all her medications. She then took me to her consulting room. I asked her what happened when there was an emergency.
Since we are not midwives, we cannot take care of such emergencies. So we have to refer them to a midwife at Ayuma, or they have to go to Jessica.
And how long does it take to get to Jessica?
30 minutes from here.
30 minutes?
Yes. And we don't have straight car from here to Jessica.
So how?
If you want to take a car, then it means you have to pass through Hawaii. You pick a car from here to Hawaii, then from Hawaii to Jessica. But if you want to pick motor, as for motor, the motor can pass through Jessica Street, but we don't have a car which goes to and fro to Jessica.
So the main means of transportation would be a motorbike. Yes. And that, do you as a nurse think that that's safe for a woman in labor to be riding a motorbike?
I know it's not safe, but that's the only means we have here.
In the Brong-Ahafo region, we met a traditional midwife who certainly did more than deliver babies. Grace Ameya specializes in traditional medicine, a craft she studied from her mother. Grace Ameya knows a lot about the medicinal properties of herbs. She complements the health service in the district with her specialist care to her clients. In the nearby village of Isutiano, it's celebration time for mothers from miles around, and their heroine, Grace Pokuya, midwife and priestess, offering an empowering mix of spiritual guidance and practical midwifery. Their mutual respect and trust build into confidence, which makes all the difference during delivery.
Bengo doctor dan dibia kohoda na masa ne yesitia a okrokrom pa wachew yero hu miawani aka kakra bi doctor so ndibia koho a nko ye kra ne nani sokra da moja mi se mba ye odi akira nko bebu makun nso ade mpachew miawani nsoro mmerekwa mpachew saa ni nyame ye madoma ntinwoye ntine ama mani ngi se meko doctor esanse doctor bia ni ho bejejo so wo yo wayi ni bia ngina ni bia bejejo so we so de ojeje so payachew me ye tinwo faye ho faye ba
ne doctor oya tete oya how so de ye ba ye nya na ho blase so no ye tane de kura ba ko ne se awo no ye mlem otim bua ya kwani nyina so ma ye tim wontem doctor anka beja wa to ko se wo atama ba wo.
Dr. Ebenezer Apiadenchira, it's great to have you back exploring a few more issues. So Doc, how do we shift the statistics of so many women delivering at home rather than in a hospital?
Yes, it's not a hospital versus community. To me, it's a continuum. To me, a community decides that we want healthy people, strong people. And they decide that this is our TB, but she's limited. So we need a technical person. And the technical person comes. The technical person advantage is that you can link them to a higher level. So the Ghana Health Service, our strategy we're trying to do is that we are placing nurses in every community assembly electoral area. We have 11,000 community health nurses now. And then we have
11,000?
Yes, we have 6,500 electoral areas. So the idea is to place them there, link them to the assemblymen, link them to the traditional people. They go house to house, they support them to go to house to house. They see all children, all pregnant women, adolescents, all elderly people, and then link them up to the nearest health center.
Let's take a look at the situation in Bompa in the East Gonja district, northern Ghana.
It's a quiet afternoon in Bompa, and surprisingly so. In fact, the village looks deserted until the big community gathering comes into view. Everyone in Bompa, it would seem, is here. The children are excited with all the attention from the roving film crew, and the welcome is loud, exciting, and fun. But soon the mood changes as the people step forward into the circle to give their personal testimonies. Access to the outside world is on the mind of Dorcas, and she tells a rather moving story about the stream.
Nkwasi kanju nzena afia kumba. Nja suru katono. Ninjan nanjama. Ma samben tkan ye manjaman shanze we. Mak samzena famako.
Next is Memuna. Adisa simply cannot wait for her turn.
Doc, I would like to shift the focus a bit from the rural areas to the urban city and to look particularly at vulnerable groups such as Kayaye.
It's past midnight and the streets are quiet, even though you can still see cars and shadows moving in the dark. A group of young girls are huddled together under the open skies, sleeping. As dawn approaches, the weather turns chilly, but all they have are thin sheets of cloth to keep warm. These streets can be mean, and there are frequent reports of rape and robbery. Aisha gets up. This is no place for deep sleep. Aisha is 4 months pregnant and has made these streets her home ever since she left northern Ghana and traveled several hundred kilometers to Ghana's capital city on the Atlantic coastline. At the local food joint, she cooks corn dough for the owner for a few cents a day. A friend also works here. She is also a teenager with a baby strapped to her back all day. At Accra's main market, the hustling is intense and every coin or note counts. Aisha earns about $3 a day. She feels tired. Her pregnancy is maturing, but can she take it easy? Abibatu also earns something similar. She is 5 months pregnant and has a child. She is as hardworking as Aisha, and it clearly shows. Her patch is the area around the railway tracks that run through the sprawling market.
So man serenganda be yin tra kurme kur kwana ne chi ni sukpa nti tinda be yin mena tra chen na free do atan tra ko chen na free nsi tan pa pa na do pem nu suka tibe nyangan chen do atama so do suka nchena ne nya ahli kul bela nya ne nyam bi chi bobe ne bi niema an la yin ne kamba borun do akwa.
Lunch for Abibatu is ice kenke, a sweet drink made from corn dough. Like Aisha, she has also never visited a hospital or seen a doctor. She treats any pregnancy-related complications herself, buying tablets from the market vendors or using traditional herbs. Lariba is also a friend and the oldest amongst them. She has 2 children and has been in Accra for 5 years.
Me free me kuomba na me nim obia. Nti me chinchin me nya nema na mesi. Me nya banko na maka. Eno na me di yesa kakra na me nya aduane di. Nti no sa no so me da abonten. Abonten na me da na me mpen so na me ni baby nti na me da abonten no. Ntuntum wie. E na mema so haye and robbers any rapings. Ni nyina so no ye ni baby a ye be konti ye timusa na me ne me kunu wo nof no na ye nyina ye do bayere ebro nkatie e na me nyim me di anyim me first born no nti first one na me nyim ye na me say oho no sika ni ho ndi me bank ran ya ba ye djuma kakra anya sika to samina ene ntare ade ehwe me ba no.
Lariba specializes in washing clothes for a small fee. She says she learnt the harsh realities from bitter experience. She gave birth on the streets, aided by only her friends. Astonishingly, she delivered her second child herself.
Ba kono me wonu wo fie we na me mpese mbe wonu wo fie na miniskante me forso ya ma anya obia e na meti ho na akwala no me hu se ye me se me ko toilet no e na me fa ntoma e na me mia meto e na me tena me nan nechi nti me tena ho no na me forso ye na me chime ye e na akwala no me ye ne nyina me de ntoma atomanim e na akwala no pie ye opia na me gya me to no na me so no mo se na me de ne tontoma no so e na me kɔ me chi kakra e na me san chimiye e na chire de no so e no so beto ofom.
Soon the sun goes down over Accra's picturesque urban skyline. Like Aisha and Abibatu, Lariba returns to the shopfront at the end of her day.
These women are delivering on the streets and don't seem to have any health cover.
Yes, for our policy now is that there's nobody in Ghana who should be lost to follow. We are placing people in charge of an area, so that when you get to a particular assembly electoral area, you have to go do house to house. So you take inventory of all the houses there. You know all the babies in the homes. If there's any cleft palate, you know it because we'll be going house to house. You know all the teenagers there. You know all the pregnant women there. So if you happen to be in the city in Accra, and the area we've been allocated, there's a GPRTU station, you have to know the GPRTU, and they'll show you where the car is. When I was in Kumasi, we went to see the allocation. We met the leaders, and then we told them that this is your nurse. This is the telephone number. She will ring the hospital, and then we took them to the hospital. They saw their hospital. It was a Kumasi, the CWC. This is your doctor, so they will make allocation for you. So anytime they had any problem, they ring the nurse rings the hospital, they come there, give them good reception. So nobody can be lost to follow. So sometimes when I see people, somebody is non-attendant, I say, how can you not be attendant? Somebody is taking care of you. And it's not only, as it should be the responsibility for everybody. If you are in a church, a religious organization, make sure that all your members have insurance card. Make sure that when they are pregnant, you link them to a particular midwife or a facility so that they are well. I believe that if we follow up that much, nobody will be lost to follow. Because even if it's a hospital we're referring to, and I have few doctors there, and the theater is jammed, I will just ring the other hospital. Can you make arrangement for somebody who is seriously maybe it needs a session or something like that, and because we are occupied here, and then we send
take it
to
up
the other place. So that's the communication, the networking, and so forth. I believe that.
And the partnerships that need to be created.
Yes.
Is it also
the media?
Absolutely. Also, of course, creating the awareness that all of this is important to be done.
Everybody has a responsibility. The health workers per se only have learned something about health, and they are giving knowledge, education to people so they can live right. But they are not the people producing health. But by the way you behave, whatever you eat, whether you exercise or not, you are creating the health. I only give you an advice as to how. If you reject it, ill health. If you accept it, we're healthy. So if we create that concept, then you find that all of us need to sit down to be talking about health. Exactly.
So how come we've suddenly, kind of relegated ourselves to all watching the Ghana Health Service as the provider of health of the country?
We are talking.
We are talking.
And also I'm happy now I'm here. I've met you. The media play a very, very important. So posing the media and say that, look, let's follow up the neatest, let's say, community every month per district. And you announce them. Or like the league table we do, football, 1, 2, 3, 4, 5. You will see how Ghana will change. Change because everybody will be responding to it. If you talk about how to ensure that people are healthy, whatever league table you make, those who have ID cards for maybe insurance cards, those who school the examination, the pass rate, all of them everybody will respond.
Doc, let's shift to health and the environment, which is a critical component and a precondition actually for improved health. Let's take a look.
A few miles from Kolebu, Ghana's leading hospital, is a scenic view dominated by a highly symbolic river. It is meant to flow casually into the sea, but it barely does so these days. Its way is blocked by waste that has created an artificial island and turned the crystal clear water into a dull, greenish sludge. Fish no longer live in these waters. Today, smoke from burning car tires rise into the air, and the smell is foul.
When I sit in class, you see that bad scent. Come, British.
It's very bad. If you're passing around here during the daytime, you have to cover your nose. I'm even sure most of the drivers passing around, most of them cover their nose.
It's like toilet it's mist. So if you come into a classroom over there. That is
At the hospital, the patients wait patiently to see the doctor. Is there a correlation between the common illnesses reported here and the environments within which we live?
If you talk about environmental cleanliness, you are actually promoting health.
Commonly here we see a lot of gastroenteritis where people come in with diarrhea and vomiting. We also get cases of typhoid enteritis. We also see a typical cholera case with a rice water stool, a patient who is severely dehydrated and can rapidly progress to death if not adequately managed. Like we know, we are in the tropics and malaria is one of the commonest causes of fever in our environment. And we know that it is related to our environmental sanitation conditions.
When we go to our hospitals, roughly 70% of all the reported diseases are what might call environmental diseases, from your diarrhea to your cholera to your even malaria.
Exactly. If you have a person thinking positively, the whole Ghana will
keeping
change.
the environment clean.
Clean. It's intersectoral. Ghana Health Service, we are decentralizing. We were told to decentralize to the local government. You know, they have a local government agency now. So from the district hospital below, all we part of the local government. What it means is that at the assembly, they will now be discussing health, education, everything, and it's like they will run it. Upstairs, maybe region and above will only provide technical support to them. So it means that assembly will now have to be knowledgeable and they should have the ownership as to how we want to change our health infrastructure, how we want to improve education and so forth. So the intersectoral collaboration or a multi-sectoral thing will certainly come in. Yes.
Thank you so much. I think it's been an incisive discussion, and I think we'll have to come back next week to explore a few things.
Thank you very much.
Thank you very much, and good night.
Thanks for watching, and good night.